Have you ever wondered what really happens inside the female body every month? Why periods happen? Or how the body prepares for pregnancy, even when you are not planning for one? In today's video, we are breaking down the ovarian cycle, its anatomy and physiology that makes the human reproduction possible. Whether you're a student, healthcare professional, or simply curious about women's health, we are making the ovarian cycle super easy to understand. By the end of this video, you'll understand why cycle lengths vary between women, what triggers ovulation, if it is possible to ovulate without having periods, and what leads to irregular ovarian cycle. If this is your first time in our channel, welcome to Diagnosis and Health. My name is Raphael. Before we dive into the cycle itself, let's establish the foundation. The ovarian cycle primarily involves the ovaries. Ovaries are two almond-shaped organs located on either side of the uterus. Each ovary contains thousands of follicles, which are essentially eggs surrounded by supportive cells. The key players in this process include the hypothalamus. The hypothalamus is in your brain. It releases the gonadotropin releasing hormone. The anterior pituitary gland. This is what produces follicle stimulating hormone and luteinizing hormone. The ovaries themselves, which is responsible for creating estrogen and progesterone, and the uterus, which actually responds to these hormonal signals. This system is called the hypothalamic pituitary ovarian axis. So think of it like a three-way conversation where each organ influences the others. Now, the foundation is established. Let's dive into the topic of the day. The ovarian cycle is a monthly process that happens in the ovaries. It is part of the female reproductive system and it involves the development and release of eggs. It also prepares the body in case pregnancy occurs. The ovarian cycle has three main phases. The follicular phase, this is when the eggs are getting ready. The ovulation, when the eggs are being released. And the luteal phase, when the body either prepares for pregnancy or resets for the next cycle. The ovarian cycle begins with the follicle phase. This phase is all about preparation and selection. It all begins on the first day of your period. Behind the scene, your brain sends signal to the ovaries to get some eggs ready. The hypothalamus releases the gonadotropin releasing hormone, which tells the pituitary gland to release follicle stimulating hormone. This hormone does exactly what its name suggests. It stimulates multiple follicles in your ovaries to begin developing. We are talking about 10 to 20 follicles that start this journey together. These follicles go through distinct stages. First, they are primordial follicles, essentially dormant eggs that have been waiting inside before you were born. So the follicle stimulating hormone awakens them into primary follicles, where granulosa cells form a protective layer around the egg. The next thing that happens is they become secondary follicles, developing multiple cell layers, and they begin to produce estrogen. This estrogen is an hormone that helps the uterus prepare a lining for potential pregnancy. Few days later, only one follicle becomes dominant. This is natural selection at the cellular level. So the dominant follicle continues growing while the others undergo degeneration, which is an essential programmed cell death that ensures that typically only one egg is released per cycle. The increasing estrogen levels from this dominant follicle create a negative feedback mechanism, thereby reducing follicle stimulating hormones production. But here's where it gets interesting. As estrogen level increases, it switches to a positive feedback mechanism, and this triggers the luteinizing hormone surge in such a way that it eventually causes ovulation. This is the moment where the mature egg is released from the ovary. Typically, the surge in luteinizing hormone leads to ovulation, and at this point, the oocyte completes its first meiotic division, becoming a secondary oocyte. The follicle wall begins to weaken and bulge outwards. Enzymes break down the follicle wall, and finally, the follicle ruptures, releasing the egg along with surrounding fluid and cells. This released egg is caught by the finger-like projection of the fallopian tube, and it begins the journey towards the uterus. The egg remains viable for fertilization for about 12 to 24 hours. Many women can actually feel ovulation happen. It may occur as a mild cramping or sharp pain on one side of the pelvis. If you are not trying to get pregnant, this is a natural, healthy process your body goes through every month. After ovulation, the mature follicle transforms into corpus luteum under the influence of luteinizing hormone. The corpus luteum produces large amounts of progesterone and some estrogen, which keeps the uterus ready in case fertilized egg shows up. At this point, the cycle can take two different parts. Part 1: if pregnancy occurs, the developing embryo produces human chorionic gonadotropin. This is the hormone that maintains the corpus luteum, which continues producing progesterone to support the early pregnancy. Part 2: if pregnancy does not occur, the corpus luteum begins to degenerate, forming scar tissues called corpus albicans. As the corpus luteum dies, progesterone and estrogen levels drop. This hormonal crash leads to shedding of the uterine lining, a process that is known as menstruation, and the whole cycle begins again. Irregular cycles can indicate conditions like PCOS, that's polycystic ovarian syndrome, thyroid disorder, or hypothalamic dysfunction. Individual differences in hormonal sensitivity, lifestyle factors, stress levels, and genetic variations all contribute to cycle length differences. That's why different women have different cycle length. What matters most is consistency for each individual woman. Note, normal cycle length is between 21 to 35 days. So if you have 21 days as your cycle length, as long as it is consistent, there are no issues with it. If you have 28 as your cycle length, as long as it is consistent, there's nothing wrong with it. If you have 35 days as your cycle length, as long as it is consistent, there's nothing wrong with it. The main issue is being consistent and not about the number of days of the cycle. Ovulation can occur without menstruation, particularly during breastfeeding or in certain medical conditions. Conversely, you can have bleeding without ovulation in anovulatory cycles. Stress, significant weight changes, excessive exercise, certain medications, and underlying health conditions can all impact cycle length regularity. Age also plays a role, with cycles often becoming less regular as women approach menopause. If you found this educational content valuable, please give it a thumbs up and subscribe for more in-depth health education videos. Share this with anyone who might benefit from understanding the ovarian cycle better. Knowledge is power when it comes to your health. If you have any questions about ovarian cycle, drop them in the comment section below and I will address them in future videos. Until next time, keep learning and stay curious about your health.